Good afternoon, my name is Veronica Kinsler. I would like to speak to you today about my work at Great Ormond Street Hospital and about what makes us unique. I am the Professor of Paediatric Dermatology and Dermatogenetics at Great Ormond Street Hospital and the UCL Great Ormond Street Institute of Child Health. I also hold a National Institute of Health Research professorship, and I am a senior group leader at the Francis Crick Institute in London. This is Great Ormond Street, where I do my clinical work. And this is the Francis Crick Institute, where I lead a research team. I am a clinician scientist. This means I'm a sort of hybrid of a doctor and a scientist. My team cares for patients with rare diseases, many of which involve birthmarks, although I do also look after children with any type of skin condition. Our clinical research has led to many guidelines on clinical management. For example, which patients with certain birthmarks also need a brain scan. And our laboratory research has revealed the cause of many of these diseases. By finding these causes, we have been able to identify potential treatments in some of the cases and to start trialing these in patients. So just to explain a little bit about the conditions that I look after, many birthmarks are now known to be caused by genetic change to the baby during the pregnancy. This is not something that the mother did or didn't do. It happens by chance. There are many superstitions surrounding birthmarks, but these are not correct. This is something genetic. And what happens is that after the fertilized egg begins to develop, at some point during the development into the baby, there is a little genetic change in one cell, but every cell that comes from that cell will thereafter contain that genetic change. And so eventually when the child is born, it will contain some cells which have the mutation and some which don't. And this is something called mosaicism. Because these conditions are rare, more than 50% of the patients who are referred to my service do not have a diagnosis or have an incorrect diagnosis at the time of referral. However, after one consultation, we are able to give a clinical diagnosis in more than 95% of cases. This has a major impact. The family is usually very relieved even to have a diagnosis because it gives them some certainty and also eliminates other worrying diagnoses. Sometimes they are worried about other things and we can exclude those. We can give more information so the prognosis can be discussed and a targeted management plan can be started. This is an example of a case that I would be referred very frequently. And very often the diagnosis is wrong here. This may be thought to be nevi, types of moles, for example. Sometimes it is thought to be normal birthmarks, common birthmarks that will go away on their own. However, when we see this child, we know what the diagnosis is. It's actually a condition called phacomatosis pigmentovascularis. And the most important thing to do when we see this is to refer for an urgent eye opinion, as these children can have problems with the pressure in their eyes, which can cause them to become blind if it's not treated early. So that's just an example of what we can do to try and improve things by giving a diagnosis. So here, the immediate referral to look for the eye examination, but then we would also make a referral for a brain scan. This is to look for abnormalities in blood vessels in the brain, which we know can be connected to these skin findings. And we also know that we can improve the outcomes for children like this if they are started on anti-seizure medications and also on aspirin. This improves their brain blood flow and they can have a better neurological outcome with an early diagnosis. We also know that we need to check for high blood pressure, as there can be abnormalities of blood vessels in the kidney, which can also be treated. However, not only do we make clinical diagnoses and clinical management institutions, we also have a unique provision at Great Ormond Street for genetic diagnoses of these conditions. So many of these conditions I see are genetic, as I mentioned, although they don't run in families. So it's important to realize it's not the same as you might think with genetics. It doesn't need to run in the family. It is a genetic change that happens just to that child when it's developing. And most of these can only be tested from the skin. So many children will have had genetic blood tests done, for example, but they do not show any positive diagnoses because the mutations, the genetic changes, are not in the blood. They often require specialist sequencing. So once we take a skin test, skin biopsy, we then also have to do particular types of sequencing in great depth to be able to find the mutations. And at Great Ormond Street, we have established diagnostic grade testing for all the dermatology genes, and in particular, we are a national referral centre for these mosaic conditions where our regional genetics laboratory has the license to do these tests. And that can be done for all children or samples sent to us. The impact of a genetic diagnosis is also impressive. This gives much more accurate information for the family. So most often, these conditions can be caused by more than one type of mutation, more than one type of gene. And knowing exactly what gene is involved in that child makes a difference. We can give very tailored information at that point about the child's condition. And when we do get a genetic diagnosis, we can advise on whether the condition might occur again in another child in the same family, which can happen, it depends what we find, or whether the patient themselves might pass it on to their children. So in some cases, these mutations can be passed on, but in some cases they can't. So we can then give proper advice to the family. And the genetic diagnosis can nowadays sometimes lead directly to targeted therapy. This is an example of another mosaic condition called Proteus syndrome. It is a type of overgrowth condition. These children are normal at birth. They usually have no abnormalities at birth, sometimes very minor changes. And then they get progressive, relentless overgrowth of many different parts of the body. Anywhere that has the mutation, in general, becomes abnormal and gets gradually worse and worse. And until recently, there have been really no treatments for this at all, other than trying to manage it with surgery. The impact of a genetic diagnosis now, we look for the gene which usually causes this, which is AKT1, mutations in that gene. And once we find that particular gene, we're able to say to these families and to these patients that, for example, they have a very high risk of fatal clotting events. So that's clotting in veins in the body. And therefore that the patient, before having any surgery done, must always have anti-clotting medications given them. It's extremely important. And that is different from, for example, other overgrowth conditions where the risk of clotting is not so high. So knowing the gene really makes a difference to our management. And nowadays also these patients may be given a targeted therapy. So in Great Ormond Street and in some other centres around the world, we are now using an AKT inhibitor. This is a drug which targets that exact gene. And we are having very good results when we start this early in life. It seems to prevent the overgrowth. So a few recent examples of a diagnosis leading to a treatment. This patient of mine has a condition called inflammatory linear verrucous epidermal nevus. It is another mosaic condition. She was treated for many years with very strong oral medications, like oral steroids, methotrexate, cyclosporin, acitretin. She had many different strong immunosuppressive treatments, none of which was successful. She has chronic itch, really severe itch, and also the condition was stopping her growing well. The whole family were affected by this condition. They were waking all night, every night with the itching, and she was missing a lot of school. So we took skin tests, as we do, and we took blood tests as well for comparison, just how we find the genes in the skin. And we did this very deep sequencing on the research side, looking for possible causes in genes in the skin. And we, in fact, found a mutation in a gene called CARD14 in some of the cells, which is exactly what we'd expect in a mosaic condition. And this gene is known to activate particular pathways of inflammation in the skin. That was already known that it could do that, just wasn't known that it could cause this condition. This was new finding. But because of what we knew, we were able to give her a particular treatment that targeted that pathway, the inflammatory pathway. This is a drug called ustekinumab. And she had a really rapid improvement. She's been on this treatment now for 3 years. She grew a lot as soon as she started it. Her symptoms are well controlled. And this is a very good example of how a genetic diagnosis can really alter clinical management and change someone's life. We also know, importantly, that this genetic change could be passed on to her children. So it won't happen in her siblings, but it could be passed on to her own children all over the body. So this is helpful as it can then help for pre-implantation diagnosis later in life, if she wants it. Another example of where a genetic diagnosis can potentially lead to a therapy is this child who is very famous, I know, in China, who came to visit us a couple of years ago. And he has a condition called congenital melanocytic nevus syndrome, where he's born with a very, very large nevus and many other small nevi that you can see here. And when he was there, we were able to give some immediate management. So we told them the diagnosis and we told them that it wasn't a cancer. They had understood that it was a cancer and that he would die. But we were able to tell them this was not the case. It is a birthmark condition. There is a risk of cancer, but it is relatively low. And he did not have cancer when we saw him. So that was an immediate relief for the family that he wasn't going to die quickly. We also undertook some investigations to exclude problems in the brain. So in these children, they do need a brain scan. And he also had some surgical interventions from the plastic and general surgeons at Great Ormond Street when he was in the hospital, which greatly improved some aspects of his problems. However, he has remained extremely itchy. He needs constant skin care and he is developing new lumps all the time. So we wanted to investigate the genetics for him to see if there was anything else that we could offer in terms of treatment. So we took biopsies when he was having surgery on his skin. And we've recently been successful at finding the gene that has caused this in him particularly. And because of that, we have also been able to identify a drug which should be able to help him in terms of the itchiness and the producing new nodules. So it may also reduce the risk of cancer, and therefore this has been a definite success. Unfortunately, I'm not able to tell you the gene today because we are yet to discuss this in detail with the family, but we have told them that we have some good news for them and we'll speak to them soon. So just to conclude, Great Ormond Street Hospital Pediatric Dermatology offers a unique service to patients with rare skin diseases, and making a clinical diagnosis and a genetic diagnosis can have a huge impact on patient care. Thank you very much. Thank you for your attention.